Welcome to my YouTube channel. Today's video, we shall be looking at the anatomy of the genicular anastomosis. The genicular anastomosis is an arterial anastomosis that is located around the knee joint. It ensures collateral blood supply and adequate blood supply to the knee joint and the leg. So if you are coming across to my channel at the first time, endeavor to subscribe so that you get notification when I upload video on human anatomy. Without wasting much of our time, let's dive into the class. The first thing is the introduction. What is genicular anastomosis? Genicular anastomosis is an arterial anastomosis that is located or found around the knee joint. That is the concept of what? Genicular anastomosis. Genicular So it is an what? Arterial blood supply or arterial anastomosis that is located around the knee joint. That is the what? The concept of genicular anastomosis. This diagram here shows us all the participating arteries and how the genicular anastomosis is fashioned around the knee joint. Now, the next outline we shall be looking at is the participating arteries. What are those participating arteries that forms the genicular anastomosis? We have number one, we have the popliteal artery. Popliteal artery. Number two, the femoral artery. Number three, the anterior tibial artery. Number four, posterior tibial artery. While number five, we have the profundal femoris artery. So these are the major participating arteries. They have their branches, which form that anastomosis. But these are the participating arteries that forms the genicular anastomosis. Through its branches, through its what? Branches. Now, this is how it does what? It goes. The participating artery that forms the what? The genicular anastomosis. Now, let's showcase it on this diagram. We have the popliteal artery. Important to note, we recall that the major arterial stem of the lower limb is the femoral artery. Now, as the femoral artery courses downward along the posterior thigh, at the level of the adductor hiatus, which is an intermuscular tunnel of the adductor magnus, it terminates at that region to form the popliteal artery. That is why the adductor hiatus is a landmark, because it indicates the termination of the femoral artery and the origin of the popliteal artery at the posterior aspect of the thigh. Now watch. This is our femoral artery. Femoral artery. Why is this dotted lines here? Because the arteries are not seen anteriorly. They are seen at the posterior aspect of the knee. Those ones that is not being represented with the dotted lines are seen at the anterior aspect of the knee joint. That is an important clarification. Now, watch here. As the femoral artery courses downward at the posterior aspect of the knee, at the level of the adductor hiatus, it becomes the what? The popliteal artery. Because after the adductor hiatus, the next important fossa is the popliteal fossa, which is a diamond-shaped depression that is located at the posterior aspect of the knee joint. Now, on this region is our popliteal artery. Now, the next artery is the anterior tibial artery, because as the popliteal artery continues downward, it descends downward to get towards the posterior aspect of the tibia bone, you get, it has to bifurcate into two terminal branches, which is the anterior tibial artery and the what? And the posterior tibial artery. Now, this is the anterior tibial artery. Here is our posterior tibial artery. Now, the profunda femoris artery is the deepest branch of the femoral artery. So it should be located at the posterior aspect of the knee. It's not visible on the anterior aspect. You get. So that is the participating arteries of the genicular anastomosis. The next outline we shall be looking at is the importance. The number one importance, genicular anastomosis ensures adequate blood supply to the knee joint and the leg during flexion of the knee, because when the knee is flexed, it leads to the compression of the popliteal artery, thereby providing sluggish blood supply to the knee joint and the leg. Now, that is where the genicular anastomosis will intervene, thereby ensuring collateral supply or adequate blood supply to the structures of the knee joint and the leg. Okay? The number two importance is that it ensures adequate or collateral blood supply to the what? To the knee joint and the leg. So the genicular anastomosis is the blood supply of the knee joint and also ensuring adequate blood supply to the structures of the leg. So that is it. Okay. The next we shall be looking at is the point of the anastomosis. The point of the anastomosis. Number one point of anastomosis is that the superior medial genicular artery, pay attention. Number one point of anastomosis, number one, is the superior medial genicular artery anastomosis with the descending genicular artery or the descending genicular branch of the femoral artery and the inferior medial genicular artery. Now see it here. The superior genicular artery anastomosis with the descending genicular branch of the femoral artery. Here is it. Descending genicular branch of femoral artery and the inferior medial genicular artery. Recall that there is a media here, which is superior medial genicular artery. Here is our inferior medial genicular artery. So, number one point of anastomosis is that the superior medial genicular artery anastomosis with the descending genicular branch of femoral artery and the inferior medial genicular artery. That is number one point of anastomosis. Number two point of anastomosis is that the inferior medial genicular artery anastomosis with the superior medial genicular artery, and the saphenous artery. The saphenous artery. And saphenous artery is a branch of the descending genicular femoral artery, which is a branch of the femoral artery. The saphenous artery. So the second point of anastomosis is that the inferior medial genicular artery, anastomosis with the superior medial genicular artery, and the saphenous artery, which is a branch of the descending genicular artery, which is also a branch of the what? The femoral artery. So that is the second point of anastomosis. Now, the third point of anastomosis is that the superior lateral genicular artery, anastomosis with the descending branch of the lateral circumflex femoral artery, and the inferior lateral genicular artery. Now see it here. The superior lateral genicular artery, anastomosis with the descending branch of the lateral circumflex femoral artery, descending branch of lateral circumflex femoral artery, and the inferior lateral genicular artery. So this is the third point of anastomosis, which is the superior lateral genicular artery, anastomosis with the descending branch of the lateral circumflex femoral artery, and the inferior lateral genicular artery. That is the third point of anastomosis. Now, the fourth point of anastomosis is that the inferior lateral genicular artery, the inferior lateral genicular artery, anastomosis with an important branch of the genicular anastomosis, because the inferior lateral genicular artery tends to anastomose with the important branch, and that branch provides an adequate blood supply, also forming the arterial or the participating arteries of the genicular anastomosis. And what is that important artery? That artery is the circumflex fibular branch, circumflex fibular artery of the posterior tibial artery. Now, here is how it goes. The inferior lateral genicular artery, anastomosis with the circumflex fibular branch of the posterior tibial artery. You get? Now watch. Here is the circumflex fibular branch of the posterior tibial artery. Circumflex fibular branch of posterior tibial artery. So the inferior lateral genicular artery, anastomosis with the circumflex fibular branch of the posterior tibial artery, also the superior lateral genicular artery, and the anterior and posterior branch of the anterior tibial artery, because these two arteries are the branches of the anterior tibial artery. So the fourth point of anastomosis is that the inferior lateral genicular artery, anastomosis with the superior lateral genicular artery, the posterior and anterior branch of the anterior tibial artery, and the circumflex fibular branch of the posterior tibial artery. Now here is the anterior tibial artery, anterior branch of the anterior tibial artery, per se. And this is also so this is the anterior branch or the anterior recurrent branch of the anterior tibial artery. You get? And this is the posterior recurrent branch of the anterior tibial artery. So the anterior and posterior recurrent branch of anterior tibial artery. So that is it. The fourth point of anastomosis is the inferior lateral genicular artery anastomosis with the superior lateral genicular artery, the circumflex fibular branch of the posterior tibial artery, the anterior and posterior recurrent branches of the anterior tibial artery. So that is the point of the anastomosis that forms the genicular anastomosis. So the next we shall be looking at is the clinical relevance. Number one is collateral supply. Collateral supply. Yes, the genicular anastomosis provide collateral supply to the structures of the what? Of the knee joint and the leg. The number two is ischemia. Ischemia could occur when there is a blockage of the femoral artery. You get? It could occur, thereby providing ischemic supply to the structures of the knee joint and the leg. Number three, I mean to say, is ischemic necrosis. Yes, ischemic necrosis could be implicated when there's blockage of the blood supply or the blockage of the main arterial stem of the lower limb, which is the femoral artery, thereby providing poor perfusion to the structures of the knee joint and also the leg. You get, which could lead to death of those tissues, which is ischemic necrosis. The number four is thrombolism. Thrombolism could be implicated because there could be formation of intravascular blood clot, which is thrombus, thereby causing blockage of the blood supply to the what? To the knee joint and also the leg. You get, thereby yielding ischemic condition of those tissues. The number five is embolism. Now, in the case of embolism, there could be dislodging of those intravascular blood clot, which is embolus. When it dislodges to another place, it becomes what? Embolus, thereby forming or causing blockage of blood supply to those regions. You get. Now we have number six, which is coarctation. In the case of coarctation, there could be tightening of the blood supply, you get, either by a compression of the blood supply, you get. So thereby providing hypoperfusion to the structures of that region. Now the next one, the number seven is aneurysm. In the case of aneurysm, there could be dilation of the blood supply to the knee joint and also the leg. You get those participating artery could be abnormally dilated. You get that is what we call aneurysm, which is abnormal dilation of the blood vessel wall. So I believe we enjoyed this class. We have come to the end. We have discussed from the introduction to the clinical correlate. Thank you so much for staying to the end of this class and endeavor to subscribe. I appreciate it.